Okay, in today's episode of Why Brienne Does What She Does, we're going to address why she's choosing mastectomy over lumpectomy. Sorry. Okay. So we are going to talk about why a woman would choose a mastectomy over a lumpectomy when given the choice, because there's also some women that are horrified by this or think, why would you do this? And I've talked to some women in the forums that don't understand why or this perspective. So let's talk about that. Right now, I qualify on paper for a lumpectomy, or in this case, it would be considered more of a partial mastectomy because of the amount of tissue that they have to take out. Tumor is close to 2 centimeters. In order to get clean margins, which means taking out the tumor itself, plus they have to take out a certain amount of healthy tissue surrounding that to be sure they got every single cell of cancer out of my body. So in order to do that, they have to take basically twice as much tissue, which means that they would have to take 4 centimeters, thereabouts, of tissue out of me. And then there are different forms of radiation. There is external beam radiation, or as women like to put it, whole breast radiation, where they just blast you with radiation on whichever breast the cancer is in. And then there are other methods of radiation that are a little bit newer. One of them is IORT. This is basically, how do I put it, interior radiation. So as opposed to going to treatments over and over and over and over and over the course of like 5 weeks or whatever your treatment plan is, in the surgical room, when they open you up and they remove the tumor, the radiation oncologist does the radiation. It's a higher beam, so to speak, more intense radiation directly to that spot that they've just removed the tumor and the tissue surrounding it. And then the hope is that afterwards, if you qualify for this sort of radiation, then you wouldn't need radiation after that. Okay, so that is what has been recommended by my doctor, is to have a partial mastectomy or lumpectomy, however you would like to call it. It's also called tissue sparing, and I do qualify for that. Now, there are quite a lot of women that have this done. They have fine results. They're happy with it. They don't have severe side effects from radiation, or they're lucky that they don't. There are a lot of things that I took into consideration when thinking about this. And number one was, yes, because of my age, because I'm so young. Let's take my grandmother, for example. She was around 68, 70 years old when she had breast cancer. And she had a mastectomy and just on one breast. And she didn't have reconstructive surgery. She just had the breast removed, and then she wore a prosthetic in her bra to look balanced. And I don't blame her. I'm sure when you get to a certain age, it's like, what do I care so much? There are actually forums for breast cancer patients that are younger women, and oftentimes younger women have a completely different outlook or perspective on having breast cancer and the whole everything surrounding it. And for example, I asked a question in one of the forums about whether women had their implants placed subpectorally or prepectorally, which means under the muscle or over the muscle. And some of the older women that responded were like, what difference does this make? It actually makes a big difference. And I understand from that standpoint. These are my reasons why I'm opting for a double mastectomy as opposed to a lumpectomy and radiation. I'm not large-breasted. Again, the lump is in I'm already a little asymmetrical with the lump being in my smaller breast. Taking that much tissue out, I will be very noticeably asymmetrical. Also, the radiation can cause fibrosis and other complications, and causes and damages the healthy skin and tissue, and can cause it to shrink. You can end up with deformations in the breast because of the tissue that's being taken out. You can end up with fat necrosis and holes and things not healing properly, and scar tissue, etc., and lots of complications surrounding that. And then putting radiation on top of that surgery already can essentially, damage things even more, and can also affect the lymph nodes. So I would like to be symmetrical. I would like to feel confident when looking at myself, when, comfortable and confident in my clothes. I don't want to have to wear a prosthetic in order to balance my breasts out. Again, I'm fairly young, and this concerns me. It matters to me. But this, again, is personal. This might not matter to a lot of women, and I understand if it doesn't. Again, I want to avoid radiation and further complications. Me having a reoccurrence, I'm at higher risk because I'm younger, for the simple reason that I will live longer. Breast cancer is most prevalent in your 60s and 70s. And if you're in your 60s and 70s and you get breast cancer, then your rate of reoccurrence is lower because you're older and you're not going to live another, however long. My risk of reoccurrence is much higher, especially when we get into the 10 to 20 year, I don't know what I'm saying, 10, 20 years from now, then the risk really, as time goes on, starts to go up and up. If that happens, at that point, I would still qualify for radiation. Once a spot is irradiated, you cannot receive radiation there again. So if I have radiation now and I have a local reoccurrence, they cannot do radiation again. So if I had, say, the lumpectomy, I had the tissue removed, the radiation, etc. If I had a reoccurrence, I would have to have a mastectomy. They can still do external beam radiation after IORT, and that's another reason I'd rather have a mastectomy, because if my results come back that the tumor is much bigger than they see on scans, which is also possible because I have such dense breast tissue, they could get in there and go, oh my God, this thing's twice the size of what we thought it was. Or if my lymph nodes are positive, then not only will they hit me with IORT radiation during surgery, but then if my lymph nodes are positive, God, I hope not, I would also have to have external beam radiation on top of it, which doubles all the side effects and horrific things that can happen to my breast, and I'm basically screwed. I have a family history. I've already had a lump in my other breast that was benign that had to be removed when I was 14, so there's some concern with all of that. So I would like to minimize my local reoccurrence risk, which means the breast area. Now, the data suggests that your reoccurrence rate is the same no matter if you have a lumpectomy and radiation or if you have a mastectomy, that your reoccurrence risk is the same. However, mastectomy lowers your local reoccurrence risk. It does nothing to your risk of it coming back somewhere else in your body. Also, if you have a mastectomy, just because you have a mastectomy doesn't mean that it can't come back in your breasts. It can still come back. You can't possibly remove every single cell of breast tissue. So it can still come back in the skin, in your chest wall and chest muscle, etc. I won't be able to take the hormone blockers that they'll want to put me on. So that, again, I feel like lowers my local reoccurrence risk. because I should be on the hormone blockers and because of my pre-existing conditions and the side effects that I would have. My quality of life, having chronic migraines, a vestibular disorder, endometriosis, which I'm probably going to have to come off of my birth control pills, which control my pain from my endometriosis, which is going to be a nightmare for me. I already experience chronic pain on a regular basis. Dizziness, vertigo. Them putting me into chemical menopause prior years and years ago to try to treat my endometriosis did permanent damage to my bladder and caused another condition. I have no interest, and this is every woman's decision. There are a lot of women that do fine on the hormone blockers, and then there are a lot of women that it destroys their quality of life so horribly with side effects that it's just not worth it for the percentage that it. So if I have a 10% chance of the cancer coming back, the hormone blockers reduce that by half, which would make it a 5% chance. So if I'm already a very low percentage in chance, it is not worth it to me to take the hormone blockers and destroy what small quality of life I still have just to reduce it by a few percent. And that's a very personal decision. A lot of women think that's crazy, and they want to do everything absolutely possible to make sure this cancer doesn't come back. But there are no guarantees. No matter what you do or steps that you take, it can come back. Once you've had breast cancer, your chances of getting it again are 50% more, I should say, than any woman that has not been diagnosed with breast cancer. And I already had only an 8% chance as it was of getting it at my age and almost no risk factors, and I still got it.